the Productive Dentist Academy podcast network.
And he looks at my wife and he says, "Do you realize your husband's $50,000 in and about 5 weeks out of the office and not using this?"
Whoa.
And I went, ouch.
Welcome back to part 2 of our conversation with Dr. Wade Kifer. If you joined us last week, you know we started unpacking some powerful ideas around how trust is built before you ever enter the room, why your hygiene and doctor handoffs matter so much, and how to talk about risk, cracks, perio, and complex treatments without any shame, pressure, or confusion. Today, we're covering how to diagnose without letting insurance dictate the conversation and how to build a team that can carry your philosophy of care through every patient touchpoint. Let's jump in.
Wait, can we just, for those that may not have heard you on our podcast before, clarify, are you an in-network provider, an out-of-network provider? Where do you stand on revenue mix, and was it always this way?
Yeah, so I started pretty much completely in network in my practice in 2006. I'd associated for a few years. Over time, we dropped a few. When COVID hit, I just came back and said, I'm done. I was like, I'm very highly trained and I was getting more confident in my skills. And I said that. Now I kept one insurance because do a lot of the team dentistry for the local
Yeah.
university here. So I like being the team doc for that. And they're on that. And that's probably the only reason I stayed on that one. Now, I mean, I still have a decent write-off on that one because we don't get rid of all the patients that are in network with that one insurance. I'm always debating on, do I do it? Do I not? I mean,
But
I've
it's like,
stuck with it just because I see some benefits, but it's harder being on network. You see that write off at the end of the month and you're like, ooh, I just gave away X $1,000 and
well, so here's the question. Do you change your script or your
I
diagnosis or
don't
your
know.
conversation?
I don't know what insurance the patient's on when I go in the room.
Oh, so you have no idea anyway.
No, I don't know. I don't want to know. Why would I?
Well, I love this
Ah.
so much because, and this is why in our live event in Denver, Colorado in September called Unrestricted, you are one of our feature speakers. And it's
Yeah.
because the thing that most clinicians, most practices allow them to restrict is this conversation. And I didn't know where you really stood on that, but I'm glad you said that because it should not matter. That's how you pay for it. That is not how I diagnose you. So that's one of the big keys into being an unrestricted practice is having that mindset before you even start going out of network. So you know where you know what your philosophy of care is. It's so strong. The other place, and you haven't gotten to this place in your career yet, but this is part of the investment grade practice formulary, is that when clinical conviction and passion and dedication to diagnosis is as solid as it is in your practice, when you partner with an associate who might become your partner, your standard is the standard. They rise to that because you're not going to allow it to drop. If you chose to go with a private equity firm or a DSO or a private group where there's going to be multiple ways and multiple philosophies, the only thing you're left with when you're not a NOMR is your clinical standard, your clinical autonomy. And more state senates are making that mandatory. California 351 bill passed, 6 other states passed. No practice management firm, no private equity, no financial backer can tell a dentist what exam tools to use, how to diagnose, or what to treatment plan. And sometimes that's just the weakest part of the whole system. And I just you're so humble and you're so kind, and yet you are so fierce about this. How did you become just this fierce? How did you take such a strong stand for your patients?
I don't know. It's something I had people call me out. I remember one of my mentors when I was going through, I've always been a CE junkie. And one of my mentors, I tell this story, and I've told him this recently, but I was at dinner one night on a boat and my wife was there, and I was about halfway through my course curriculum training. And he's there with my wife, and he's probably 70 at the time. And he looks at me and he says, "How much of this are you doing? You're halfway through this." And I said, "I'm doing pretty good. And I'm working on some bites." And I said, "I'm not doing it on everybody. So, I mean, I get it. This is a process because this is where I was at the time." I said, "I'm not doing it on everyone." And he looks at my wife and he says, "Do you realize your husband's $50,000 in and about 5 weeks out of the office and not using this?"
Whoa.
And I went, "Ouch." And then he said, and he laughed, kind of like a grandpa figure would. And he said, "All right, I'm going to tell you how to fix this. I need you to go back on every patient and do a full comprehensive exam, diagnose all the risk factors on everyone. Don't skip nothing. Otherwise, you're not doing your patients or yourself a service." And I just took it to heart. And so I do it on everyone.
Doctor, if PPOs have you feeling restricted as a dentist, but you're not sure if going completely out of network is the right move for you, that tells me that you are right at the stage where having a strategy and plan is essential if you want to protect your revenue and grow. Investment Grade Practice, powered by Productive Dentist Academy, is hosting a live event this September that will help you design the right revenue mix for your practice. At Unrestricted, the End of PPO Dependency live, hands-on workshop, you get to work with renowned business and clinical experts who will help you analyze, clarify, design, align, and activate a plan so you don't have to feel restricted by PPOs ever again. Go to investmentgradepractice.com today for more information and to secure your seat. This event is strictly limited, so go to investmentgradepractice.com today.
I mean, they deserve that. And then my own stick on that is I try to do it in a non-judgmental way. I would say that's kind of been my own piece of how do I put that disease or blame on the disease and not the patient? How do I get us on the same side fighting the disease, me and the patient versus the disease? And
Ooh, being the
so,
patient versus the
Yes.
disease. I
Yes.
Oh,
I
I
love
so
that.
want AI to create an Avenger avatar for you. Yeah.
oh Lord.
Da, 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 da.
So that was kind of it for me, is someone challenging me. And that's why, you need mentors to this. No one, I mean, say no one, most people don't figure this out on their own. Um, One of my mentor's lines is none of us are smarter than all of us. Right. And so when we work together and come up with these things and you kind of learn from your mentors and then you put your own little spin on things, all of a sudden the profession goes forward and we grow. So, that's why we're here with going to Denver and doing clinical calibration institute and mentoring at these other courses because we want to see the profession grow. We want to see everyone do better. This isn't a limited mindset, right? We want to rise all of us together and it just helps the profession go up. So I don't know. That's kind of what it is.
Wade, I'm really curious how much you invest in your team because when you say we all rise together, there's so much importance in that team element. And I would hate to be someone who works so hard on my communication. I've got them up to the plate. They're ready to say yes, and I hand it off to the team, and then they don't schedule. And you and I have intimately talked about this in other episodes. Folks, go Google everyday practices and you'll see Wade and hear the story on that. So I'm really interested in hearing what that handoff looks like and how and like how much time you invest and what is that process so that you can bring your team into your why and help them get to the same level that you have poured decades into honing over the years.
Well, I mean, to expect your team to be at your level without training and bringing them up is just stupid, right? And so, when I talk and we talk about how many hours a month we meet, I mean, we meet on average 8 hours a month with our team, and that's
Mm.
broken down into a couple of 1 hour segments, a 3 hour segment, a 2 hour segment. And, people think that's crazy. And what's even crazier is at our production level, I mean, for the office, we're over $3,000 an hour.
Mm.
Right? And so to give away 8 hours let's just
Yeah.
$25,000 worth of production in those 8 hours. But I wouldn't be producing that as an office if we didn't do that. Right. And then it's way smoother because we got on this podcast at 3 o'clock and I think I was 1 minute late. And but I don't run behind. My day ended at 3, right? We are efficient. We communicate those things. Last month, for example, my team's been here a long time. We practiced handoffs at the front desk because every step's got to be there. We spent 30, 40 minutes doing handoffs. It doesn't have to be a full hour because we're pretty good at handoffs, but we review them and people get praised to the ones who are doing it good so that others see that. And, we just kind of try to mimic this person and everything. And so, yeah, we do it. And so during that 8 hours, we may do occlusion this month and handoffs and customer service and as little things. If you hear the phone ring and you're in the back, answer quickly because that means the front didn't grab it. All these things are just meeting things, handoffs from the doctors. We can go over and over and over. And so we just create a checklist. We block off the meetings every month, but we don't know what the topics will be. And my office manager comes up with a list of topics, but if we notice, hey, we're dropping the ball in this area, that climbs the list. As a doctor, I don't do them all. One of the hygienists did airway last month because she's a myofunctional therapist. One of the hygienists will do perio. We have meetings. Some of them are just routine as far as emergency management. What's in the emergency box, right? The albuterol inhaler, the aspirin, all the things. And so it's all structured every month. So tomorrow we have a 2-hour meeting. It's our first meeting of the month. So we're going to go over last month. We'll go over our numbers, our productivity, our diagnosis, where we struggled. Each hygienist will go over all that stuff. So it's a lot of meeting, but it's not yelling. It's not strict. It's all educational. We try to make it fun.
Yeah.
But it makes a well-organized team so that we drop the ball less times, which is a lot less stress.
You're like the poster child of a true investment grade practice, meaning you are still investing in the team training. You understand as a leader of the practice that you may not be seeing every touch point, right? Or seeing every situation. And so I love that your team, which speaks so highly of you, is coming to you saying, hey, we need to revisit handoffs. I would say oftentimes that's something that a doctor will implement in their practice in the first year and then they never talk about it again, right? So the fact that you're bringing these basics but keeping them very top of mind for the team, that is a well functioning team and process that you have created. So I'm wondering, because you mentor dentists all the time, you yourself you were mentored in different ways. So what would you say to a dentist that's maybe feeling frustrated with, feeling confident to diagnose comprehensively, maybe some of those systems like you talked about? What would you say to them as a mentor?
Um, Surround yourself with mentors, right? Because I didn't come up with any of this stuff. My first practice management conference was PDA, like I said, in 2010, and I hired a coach, right? And they set up those systems in office. I just didn't end it, right? When someone said, do this, one of my mentors from the Coist Center, I just did it. And so it doesn't happen overnight. I tell people, I think I've been fairly successful in my career. I'm very happy with where has gone. But the point of that is like I didn't set out, everyone says to set out with goals. I never sat out with a goal and said, I want to speak for this company.
Mm.
I want to be a mentor. I didn't do
You
that.
really didn't. I
Yeah.
remember you being like, I'll do it, but
You're the most reluctant ever.
little
Don't put me
reluctant.
But
on camera. Don't let me do it virtually.
Yeah.
but I'm glad I did them. But what I did do was work very hard every day, right? And then you look up and you look up 5 years later and you go, "Oh, all those little steps added up, and here I am," even if I didn't plan on being there. So I'm not saying those kind of goals are bad. I set budget goals and production goals and all those things, but I never really set goals to be, "Oh, I wanna teach at this place or do this or lecture here." It was more, "I'm just gonna put in the work and then share with what I do." And so with the team, and the reason I kind of went with that story is because we just set up the meetings and you do the little things and you keep setting up the training, and the training's on the schedule. So I tell patient or tell doctors, block it for a year. Don't worry about what goes in there, but just block all those meetings, is because after 2 to 3 years you look up and your practice is a totally different practice.
Yeah.
If you'll sit there and implement 2 hours on Thursday afternoon with just you and your treatment coordinator to go over cases.
Yeah.
I mean, I talked the cases when I didn't have other dentists to talk to with my treatment coordinator, and all of a sudden I got more confident. And she'd ask questions, and it was almost like she was prepping me to do it in front of the patient. She'd be like, "Well, why are we doing it this way?" And I was teaching her, but she was training me to give a
Yeah.
better explanation, you know? So you've got to just block the time. And even if your goal isn't, I mean, you can have the goal to sell X amount of cases, but if you'll just work on getting better at the cases, the selling happens. And so, like I said, I never set up with certain goals. I just set up to work hard and be diligent. And then the goals just happened. It's probably the wrong way to think about it. I should have had the goals
No.
first, but
I love that so much.
Yeah.
And given my tenure in the industry, someone said, "Where are you going to be in another 10 or 15 years?" And I was like, "Upright and eating solid food." You know, that's my goal. That's my big life goal. But I want to ask you the killer investment grade practice question. I haven't checked in with you on this one in a while. How long do you know that you could step away from your practice and you know for sure that it would continue running as well or better than if you were there? How long can you be out of your practice?
Uh, I'll give you 2 answers to that, because one of them is, I don't know, I am such a, driver of the production. Without my production financially, I would worry about my practice because 'cause I'm a big part of that. As
Yep.
far as how it runs, I don't have to be here at all. My
Mm.
office manager has told me when I retire, she doesn't want me to retire because she wants the team and her to run the place. I don't have to be here. She just doesn't want me to sell it.
There you go.
So the
Oh,
team can completely run the practice without me here. That is not a, we're all on the same
Man, that is a testament,
page.
Wade.
That is, I mean, talk
I
about a team that, gal, I mean, I want to come be part of the team, Wade. Like, but to have a
It's
team,
infectious that way,
it
Sarah.
is,
It is.
it is, it is. But to have a team that can function without you there and you don't even worry about it, but then to have an office manager that's like, we just don't want you to sell, but we're going to keep this going because we believe in how we show up for patients and how
100%.
we treat them. And I mean, that is powerful. It's
I mean,
really
I am
powerful.
gone between, I mean, I've tried to live that. I mean, I remember when I went to PDA, Victoria and Bruce used to say, the goal's 1,200 an hour. And I don't remember what it was, 8 to 10 weeks off a year. And
Yep.
I'm higher than that. And I mean, I'm 10 plus weeks off every year. I mean,
Yes.
almost every month I'm gone a
Good
week.
for you.
I do not get calls from the office. I do not get text. If anything, it's me texting them, "Hey, this is what I learned." And they're like, "Stop it." Right? And so, um,
we
Enjoy
just
your
did.
vacation. Leave us alone.
well, most of it's not vacation. Most of the time out of the office is dental related, but that's just
CE,
me.
yeah.
And
Yeah,
I'm probably 5 weeks of vacation a year and another 5, 6 weeks of work off. So
that's nice. Well, you know what you've done is you cross the threshold, right? You come into dentistry and the easy part is the clinical and the hard part is the business. And like all doctors, you doubled down on clinical education, but you doubled down on your business education and you didn't stop there. You embedded it in the systems with the team. And so you've solved all the hard problems. and you're left with one challenge. How do I mentor someone up to my level of productivity? Which I have no doubt that you'll do that. And now that your associate's back from maternity leave, I'm sure you'll get right on it.
Oh yeah, she's killing it. She's doing well, and yeah, my next goal is, I mean, I'm going to bring in another associate, and
Yeah,
uh, hopefully, they'll want to take over someday. But I plan to go to 2.5, 3 days a week here in the next year or two. So
nice. I had one of my 5 practices that ran like that, and the team it was team driven. I didn't know until after I purchased it because looking at the financials, it was pretty steady, 1.1, 1.2 million for like 5 years, didn't vary much at all. I then, after I purchased it, realized they had 11 doctors in 11 years. Like,
whoa.
that's a lot of doctor turnover, right? But and they told I'm still friends with this team, and they're like I was like, "What how did you do this?" And they go, "I don't know. It's a joke with the patient, like, 'Hey, who's the doc today? What do you women keep doing to him to run him off?'" You know? But small community, everybody knew him, everybody loved him. I had another practice, I couldn't close my eyes and go to bed at night that they weren't trying to buy Dave Matthews tickets on the office debit card, you know? So it varies
Hey.
wildly.
Hello, Dave.
I
Yeah.
was gonna
Yeah.
say that's a good
Shout out to
time.
Dave.
I
Is
know,
that
that's
a
how
new
I
perk
figured.
that I'm
Yeah.
unaware of? We can.
Well, Wells Fargo called me like 3 times. They're like, "This charge just won't go through." And I was like, "Well, how much is it?" And they're like, $800. And I said, "Well, our limit on the card's like $250. What are they trying to buy?" And they go, "I don't know. DMB Media." And I was like, "Oh, the office manager loves Dave Matthews. I bet she's trying to get tickets."
Some VIP tickets there.
Yeah, yeah.
Nice.
So it's good that you have systems in place and you know what kind of team you're surrounded by.
Yep.
She wasn't there long after the police officer came to the practice
Oh,
to escort her away.
Well,
Oh.
Wade, one last reflection I have. Thank you for so much of your time and sharing your knowledge. And I think this kind of plays into the unrestricted event that is coming up in September. And I'm really grateful that you'll be presenting there. You've shown us how to communicate well, but also paint a clear vision. And having your team be that self-sufficient and at that place was, I have a feeling that you do not spring initiatives or things on your team spontaneously. So I know it can shock a lot of people. We recommend that if you are dropping PPOs or going to go completely out of network, that you put a runway in place, that it's not something that you do overnight and just decide, I'm done. In fact, 18 months would be preferred. So I think your philosophy and leadership, and I guess I'm looking for some validation there, is that in order to get your team to that level, you've got to not just paint where you're going, but also give them time to understand the why and take incremental steps that get you to where you can turn around and say, oh my gosh, I put those 2 hours aside and they have really grown far past what I even thought was possible.
yeah. So, in our practice, for example, when it's like the PPOs, like tomorrow, we will say how much we wrote off for the insurance and how much we wrote off for care credit and comp finance and stuff. And I mean, those are all tools, don't get me wrong. But there's always a quip, man, what else could we buy with $50,000 that we just wrote off? And so when we come to the decision of insurance and everything, it is not, it's my practice, but it is not me going, all right, we're going to drop. It's been this discussion of, man, because we sit there and dream at these meetings too. What would we do if we had an extra this and that? Okay, how much patience do we think we leave? So no, it was a full office work together because it's not, hey, this is what we're doing. I mean, sometimes I've bought a new scanner. I'm gonna tell them at the office tomorrow. That's just a fun surprise. We need another scanner.
See, I was kind of wondering, is it like that? You go to a show and then you're like, woohoo.
Oh,
Yeah, but I generally
Man.
don't. But they've been asking for another scanner, so that was it. So that'll be the surprise tomorrow. But we start talking of, are we dropping insurance? Are we adding a doctor? Are we adding a hygienist? It's problem
team
solving
choice.
beforehand as a team where we're at, right? We're doing some social media marketing, just the guy, and I've trained my front desk Hansen. It's like, he's like, well, I don't have spots to put the patients. Well, I tell him he's got to problem solve that. So now he's working with the team. How can we create spots? Because I can't do marketing if we don't put anyone have anywhere to put them, right?
Right.
So it's not me doing those things, it's the team and empowering them because my office manager started as my assistant minimum wage 20 years ago, and now she completely runs the office. My assistant was 14 years ago and she'd never assisted, and now she sells 50,000 to $100,000 worth of dentistry every month out of her chair, and our front desk person had never done dentistry. Our other one had a year and she's been here 18 years. So it's like we empower them to do that so that no, I'm not making decisions. I'm kind of the vision person of the office. I feel Victoria, I kind of try to steal that from her for PDA. Because I know Reagan's probably a lot more organized with
What gave you
things.
that idea?
So
It's like,
I could see where you were going with that.
sorry, it just went there. So I do. I
Visionaries
try to
need
be
their
the vision
integrators.
person.
That's
And
right.
they come up with some of the ideas, and I might throw some ideas, but my ideas aren't better than their ideas.
Right.
I sense the problems of saying, "Hey, this isn't working for me, and I don't think it's working for the practice." And sometimes I'm like, "Yeah, it is working for the practice. That's okay, because not all my ideas are there."
Hey,
And
my
so,
team says the same thing. It's working for us. We think it's a you problem.
so I use the team that way.
That's fun.
Yeah.
You know what? This will be my last input here today. Thank you so much for such rich content, and I can't wait to see you in Denver. A good friend of ours and alumni, Cheryl Brunell, I interviewed her for an article one time, and she said, my friends ask me, why do you invest so much time and money in your team training? And she said, well, they said, what if they leave? And she said, "Well, what if I don't invest in them and they stay?"
Yeah, that's awesome.
Yeah, and so I think I would always rather overinvest in team and help them build their skills, and if they choose to take that to their next position and you're part of their journey, well, that's great, and because if they stick around, they should evolve with the business, and so thank you for modeling that.
Yeah, I've sent one. I'll give you an example. I sent one to a photography class um, in Virginia or in Charleston, and she goes out there. She learns all this amazing photography, and she's no longer here, but she still brought it back and taught the rest of the team. Right. And I do find that the more I invest in them, the less likely they are to leave, but it's not always like that. So you can't look at that with that limited mindset because she brought back a skill set we're still using for the rest of our group. So, I mean, if I ever lost something because I spent that much money or time on a person, yes, but I can promise you I've gained way more than I've lost by doing it.
Well, thank you, Wade, so much for being on both podcasts. I cannot wait for you to present this September. Thank you for being on faculty with us and just to end it on Bruce's note that I have up in front of my face all the time. Become the best at whatever it is you do, and then share it with others. And you've given us a master class today.
Thank you. I'm glad to be here. Looking forward to September and hope to see everyone there. So.
At Productive Dentist Academy, we've helped thousands of private practice owners find the clarity inside their data and take control again, starting with a free 60-minute coaching session. Head over to investmentgradepractice.com right now before the next patient sits down to claim your free 60-minute coaching session. That's investmentgradepractice.com.